Atelectasis. Atelectasis is a complete or partial collapse of the lung. It occurs when tiny air sacs in the lungs known as alveoli deflate either partially or completely. Alveoli help to exchange the oxygen in the air for carbon dioxide, a waste product from our tissues and organs. In order to do this, alveoli must fill with air. When some of these alveoli don't fill with air, it's called atelectasis. This leads to no oxygen and carbon dioxide exchange and in turn causes the limited supply of oxygen to the organs and tissues. Initially, a small part of the lung may be affected, but over time may involve other parts of the lung. Atelectasis can occur in anyone and at any age. Atelectasis is different from a collapsed lung, although the term can also be applied to a condition called pneumothorax. It's a common respiratory problem, especially in post-operative patients who have undergone thoracic or abdominal surgeries. Types. Atelectasis can be divided into three main types: obstructive, non-obstructive, and adhesive atelectasis. Obstructive atelectasis is caused by blockage of the bronchial passageways by inhaled foreign particles. Obstructive atelectasis can also occur as a complication of surgery, mainly in postoperative patients under general anesthesia. This is because the anesthesia triggers an increase of bronchial secretions and also prompts shallow breathing. It's estimated that around 90% of patients undergoing a major surgery end up having atelectasis after the surgery. Non-obstructive atelectasis can be caused by either injury to the chest, pleural effusion, lung scarring, lung infections, and tumors close to the lungs. Adhesive atelectasis. Newborns and older adults are susceptible to this condition who are unable to breathe spontaneously as some of their air sacs do not inflate as expected. The reason behind this type of atelectasis is the lack of the surfactant in the alveoli. Causes. Obstructive atelectasis may be caused by many things, including a blocked airway or pressure from outside the lung. This prevents air from getting into alveoli, so they collapse. Some causes include an abnormal growth or tumor in an airway, mucus buildup or excess mucus blocking an airway, and inhalation of a foreign object such as a small toy part or small pieces of food. Children are at higher risk. Causes of non-obstructive atelectasis include certain lung diseases including infections, pulmonary tuberculosis, pneumonia, a chest injury from a traumatic event such as a car crash, pleural effusion, pneumothorax, indirectly causing some or all of a lung to collapse. Any surgical procedure. Nearly everyone who has major surgery develops some amount of atelectasis. Lung scarring. Long-term exposure to irritants including cigarette smoke. This scarring is permanent and makes it harder for your alveoli to inflate. Surfactant deficiency. Alveoli contain a substance called surfactant that helps them stay open. When there is too little of it, the alveoli collapse. Surfactant deficiency tends to happen to infants who are born prematurely. Risk factors. There are several risk factors associated with developing atelectasis. Some of the most common risk factors are lung diseases, obesity, smoking, pain or injury, exposure to general anesthesia following a major surgery involving the abdomen or the chest, old age and premature birth, certain disorders like muscular dystrophy or spinal cord injury, certain medications, and chronically ill patients with the inability to move or change position. Symptoms. Atelectasis often has few symptoms if it develops slowly or involves only a small portion of the lung. Common symptoms include trouble breathing, chest pain, shallow rapid breathing, wheezing, cough, rapid or increased heart rate, cyanosis, fever, pain around the affected side of the lung. When atelectasis involves a lot of alveoli or comes on quickly, the symptoms can become more profound as oxygen saturation levels in the blood begin to decrease. This can lead to a sudden severe drop in blood pressure, rapid heart rate, and shock. Diagnosis. Atelectasis is often confused with pneumothorax, so a thorough diagnosis is necessary. To diagnose atelectasis, your doctor may do a physical exam, review your medical history, and look for any previous lung conditions or any recent surgeries. He may suggest few tests such as checking the blood oxygen level with the help of oximeter to determine if adequate oxygen is supplied to the body. However, other tests may be done to confirm the diagnosis are a blood sample, a chest x-ray, CT scan and bronchoscopy. Treatment of atelectasis is focused on re-expanding the lung to its normal size. The approaches can vary and depend on the underlying cause and how severe your symptoms are. Mild atelectasis may go away without treatment. If a tumor is the cause of the collapse, surgery may be involved. Chest physiotherapy. Chest physiotherapy is undertaken for post-surgical atelectasis. It includes coughing and performing deep breathing exercises or incentive spirometry. Incentive spirometer allows you to take slow deep breaths to improve the functioning of the lungs by draining secretions. Chest tapping or percussion. Tapping on your chest to break up thick secretions so they can be coughed out. Postural drainage. It requires sitting or lying in certain positions to help move mucus and secretions out the lungs. Bronchoscopy. This is a procedure in which a bronchoscope is inserted through the mouth or the nose to visualize the airways and the lungs for any internal obstruction or mucus plug. Medications. Bronchodilators and mucolytic agents are used to treat atelectasis. Drainage. If your atelectasis is due to pneumothorax or pleural effusion, your doctor will drain air or fluid from your chest. To remove fluid, your doctor will insert a needle through your back between your ribs where the fluid accumulation is identified. The fluid is gently sucked out through the needle to relieve the pressure of the lungs. To remove excess air, your doctor may insert a chest tube. The chest tube may need to be left in for several days in more severe cases. Surgery. In very rare cases, you may need to have a small area or damaged lobe of your lung removed. If a tumor is causing the atelectasis, treatment may involve removal or shrinkage of the tumor with surgery with or without other cancer therapies. Prevention. In adults, atelectasis most commonly occurs after major surgery. If you are undergoing any surgery, talk with your doctor about strategies to reduce your risk. There are certain things you should do to prevent atelectasis. Avoid smoking. Perform deep breathing exercises focusing on long inhales and controlled exhales, which may lower the risk of atelectasis after certain surgeries. Use an incentive spirometer. An incentive spirometer is a simple handheld device that will expand your lungs by helping you to breathe more deeply and fully. Make an effort to cough to clear any mucus or sputum from the lungs. Move around. It's important to ambulate or change positions after undergoing surgery for the lungs to expand and reduce the risk of infection. Drink plenty of fluids. Drinking warm liquids frequently can help loosen mucus and help you to expel it more easily. Atelectasis in children is often caused by a blockage in the airway. To decrease atelectasis risk, keep small objects out of reach of children. Complications. Atelectasis, when diagnosed early, can be treated but may lead to few complications that are discussed below. Hypoxemia, pneumonia, respiratory failure, bronchiectasis, pleural effusions and empyema, and post-obstructive pulmonary edema. Outlook. Generally, mild atelectasis goes away quickly once the cause is addressed. Types of atelectasis are associated with the causative factors of the condition. The most common factors that can cause atelectasis include internal obstruction of airways, external compression of airways, and thoracic and abdominal surgeries. Atelectasis that affects most of your lung or happens quickly is almost always caused by a life-threatening condition such as blockage of a major airway or when a large amount of fluid or air is compressing one or both lungs. Understanding what type of atelectasis is crucial as it helps identify probable complications as well as the best approach for treatment. Please subscribe, follow me on Instagram, hit the bell icon because that's how you get to be updated about my every single video. Thank you.